Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Natea Taylor, and I'll be your host. Our webinar today is on using assessment to strengthen support for fathers and families. We have 4 presenters who will discuss assessing the well-being of fathers and engaging fathers in assessments of their children's health and development. First, we'll hear from Dr. Tova Walsh, who is an associate professor in the Sandra Rosenbaum School of Social Work at the University of Wisconsin-Madison and an IRP affiliate. Next, we'll hear from Kevin Brumman. He is the co-founder, excuse me, and program administrator of the Alameda County Father Corps. We'll also hear from David Comer. He is the health project supervisor of the DAD project at the City of Milwaukee Health Department. After that, we'll hear from Joshua Counselor. He is the manager of operations and project manager of the Ohio Commission on Fatherhood. Thank you all for being here. This webinar is co-produced with the Wisconsin Child Abuse and Neglect Prevention Board and supported in part by funding from the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation. But views expressed by our speakers don't necessarily represent the opinions or policies of that office or of any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from each of our presenters, we'll spend the last 10 minutes or so at the end for a live Q&A. You can type your questions in the Q&A box. We did get some questions submitted as people registered, so we'll be queuing some of those up as well. Feel free to participate through the chat. We love to know who you are and where you're joining us from. I also want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. We'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. So with that, thank you again for being here, and we'll get started with Professor Walsh.
Thank you so much, Natea, and thanks everyone for joining us. It's fun to watch the chat and see people all over the country coming to participate. We are excited to have you with us, and I'm really excited to have 3 terrific guests to talk about this topic. So this is the 13th in a series of father-focused webinars that we've done together with the Institute for Research on Poverty and the Wisconsin Child Abuse and Neglect Prevention Board. And over the course of the previous 12 webinars, we've talked a lot about strategies for supporting engagement of fathers in services. We've talked about a whole range of topics, really emphasizing the centrality of fathers and children's development. But one thing we haven't covered yet is thinking about how you get a sense as a program of where you are in order to think incrementally about how to strengthen your engagement of fathers, how we assess fathers' own well-being, or how we engage fathers in assessments of their children's health and well-being. So those are the 3 topics that we're going to be covering today. It is a lot to get through. We have 3 tremendous experts joining us, and I'm going to start by asking each of them to introduce themselves. So Kevin, if you'd like to go first and just briefly tell us about the work you do and how you came to it, that would be great.
Sure. Thanks, Tova. My name is Kevin Brumman. I work for an organization called First 5 Alameda County, which is funded by a Proposition 10, which is a cigarette tax that was passed back in 1999, I believe. We started the Fathers Corps about 12 years ago in 2013. I guess it's 11 years ago at this point. The program is focused on creating a father-friendly system of care for families. I'm a father of 3. My children are adults now, which is wild. I was raised by my dad. My dad had 4 brothers who were amazing uncles to me, and those that are still with us are still part of my life. So I've been fortunate enough to be surrounded by just some really, really amazing men my entire life. And that's how, and that's my why. That's why I got into this work. And I'll leave it at that.
Thank you so much. David, could you go next, please?
Absolutely. Thank you, Tova. David Comer, the Direct Assistant for DAS Project, Supervisor within the City of Milwaukee's Health Department. The DAD Project, very similar to Kevin, our program has been in existence for about 11 years. It started off as a pilot program with a community-based organization. And then, slowly got adopted by the City of Milwaukee. DAD Project, it's a City Milwaukee program for expecting and fathering children under the age of 3 years old. One of the unique things is that we recognize dads as the primary caregiver of their child, and which is a very unique perspective. Because many programs look at mom as a primary caregiver, so fairly and unfairly on both sides. What drew me to this work overall is my birth story. My daughter, I have three, I'm a father of three as well. My daughter will be 14 soon, and I remember being a participant in like birth to three nurse family partnership as a father. But mom enrolled us into that program, and so she emphasized the importance of me being engaged and being involved and knowing these things. And so and I finally found, and I realized that the experience I had was really, really unique. And so I wanted to ensure that fathers also had the opportunity that I had, and because it definitely prepared me to be a father, and laid the foundation for where I'm at now.
Thank you so much. Josh, would you go next?
I'm Joshua Counselor with the Ohio Commission on Fatherhood. We are a state level entity with structure and law since 1989. So that's 25 years, which is very impressive. So this is one of those positions I used to hear people say they love their job. It's not a job. And I didn't understand that until I found myself right here. And I really enjoy the work that we do. I am also a father. I have two, a 12-year-old son and a 9-year-old daughter, happily married to my high school sweetheart. Shout out to Carla. So thank you.
Thank you. So I'm excited to have all three of you with us and to hear more about what you do today. A couple quick comments. One is feel free, folks, to use the chat if you want to respond to things that are happening. There's a Q&A box where you can ask questions that will come to pull into our discussion at the end as we're able to. And we'll just respond already to the question in the Q&A box that yes, you can watch recordings of the previous webinars. And everyone who's registered for this webinar will get a link to the recording of this session afterward. And we can also share links to where you can watch prior webinars as well. So we're going to move into our discussion. I'm going to kind of keep us moving a bit and facilitate, but I'm really looking forward to discussion with our three panelists. And so, Kevin, we're going to start with you and ask you to tell us a little bit more. You mentioned that you coordinate and lead the Alameda County Fatherhood Corps. I've named your organization in previous webinars because I always look to your father-friendly principles and the diversity of fatherhood photo bank and some of the tremendous resources that you've developed. But I'm hoping now that you can talk a little bit with us about how you help programs to apply those principles in their work, to assess their father-friendliness and think about how they can improve on their engagement of fathers and services and better meet the needs of fathers. So we'll turn it over to you.
Sure. Thanks, Tova. Let me share my screen. It's not the slide I want to be on. All right. I'm going to start off just providing an overview of the Father's Corps program model to give you a little bit of background on how we started, why we started, and how we developed the tools that we'll discuss today. The Father's Corps started off as a cross-systems collaboration. We started back in 2013 as a cross-systems collaborative effort of First Five Alameda County and our Alameda County Public Health Department. Since then, our collaboration has expanded to include all four of our major county systems. That's Alameda County Health, Alameda County Social Services, probation, and child support. It's the first time in our county that all four of our major systems have funded an initiative. The program lives at First Five and is supported by the infrastructure of First Five. We started as a learning community. I was a program officer for our community grants program for about 6 years. I reviewed hundreds, and this is no exaggeration, hundreds of grant applications every couple of years. And we never received any father-centered or father-focused grant applications. For an organization that is meant to support children birth to 5 years old and caregivers of children birth to 5 years old, we never had any father-centered programming. So not just in our community programs, our community grants program, but all throughout the agency, we never had any father-centered or father-focused programming. And at best, that's an oversight. But it's a pretty significant oversight for an organization meant to support caregivers of children birth to 5 years old. Our work focuses and falls into three very distinct categories. Systems change. We work every day to create a father-friendly system of care. Capacity building, we provide a series of trainings throughout the year to build the capacity of the providers who work within these different systems, both community-based and public service systems, to build their muscle to engage and support fathers, but not only that, but to see fathers as well. You have no idea how many times we talk to dads and they talk about dropping kids off at school and being ignored, going to the doctor's office and being ignored, or saying, hey, can you give this information to mom? And so we really work to shift the view of fathers. And then father engagement and support. We do have some direct service components. We think it's important if we're going to create a father-friendly system, and if we're going to provide trainings, then we need to stay connected to fathers themselves and ensure that the information that we're providing or the programs that we're building are relevant to their needs. And all of this work sits on the foundation of highlighting the true narrative of fatherhood. Narrative is important. What we think about dads, how we see dads, dictates how we serve or how we don't serve fathers. What we think about dads and how we see dads dictates what our budgets look like, what our staff looks like, what our spaces look like. And so the narrative piece is foundational and is a thread that runs through all of our work here at the Father's Core. These are some capacity building efforts, and I just want to let you guys know that about 85% of our capacity building is virtual. So they are free. They're open to everyone. We are not checking zip codes. So while we are the Alameda County Fathers Core, we do have participants who attend our trainings from all over the country. So we offer our father-friendly provider network, and that builds the capacity of participants to effectively see, serve, and support fathers. It builds their muscle and understanding of fathers' needs. We also have our healthy relationships learning community. We're into our second year of that. We piloted that program. If you're doing fatherhood work and you don't have a healthy relationships component, I encourage you strongly to look at that, or at least figure out a way to weave that in. Healthy relationships and co-parenting is something that comes up every single day in our work with fathers and father figures here in Alameda County and beyond. And then we also provide fatherhood trainings and technical assistance to our public systems partners and to our community-based organizations, where we go out and actually provide training. We've just finished up a contract with the Berkeley Public Health Department, offering a fatherhood training series to their staff, and also the Family Justice Center Network in California, providing a father-friendly training series to their staff, all with the ultimate goal of just, again, building their muscle to engage and support fathers and father figures. What we've seen is a lot of these folks who are looking to engage families, it has been a blind spot. Father engagement has been a blind spot, and they don't necessarily feel prepared to engage and support fathers. And so we are the entity here in Alameda County that provides a lot of that training to our systems and community-based partners. Some of our systems change efforts, we identified a set of father-friendly principles during that first year of learning community. Those father-friendly principles serve as a roadmap for organizations to effectively see, serve, and support fathers and father figures. It is a provider-facing document, so these aren't father-friendly principles for dads or for parents. These are for service providers to ensure that they are intentional and effective in their engagement of fathers. So the Alameda County Board of Supervisors adopted those father-friendly principles back in 2015. I've already talked about coordinating fatherhood training series for public systems. And again, before we started this work in 2013, these training series did not exist, at least not here in Alameda County. So we definitely filled a gap in training here in Alameda County. And I'm happy and proud to say that we are doing business. We got a long way to go, don't get me wrong, but we are doing business very differently in Alameda County, doing a much better job of establishing and creating father-centered and father-specific services. And I think it is, not I think, it is a direct result of the work that we've done here at the Father's Corps. We've coordinated Daddy and Me events for Oakland Head Start. We played a pivotal role in establishing the California Fatherhood Council, which was convened by the California Department of Child Support. And so they're trying to put together a statewide initiative around father engagement and support. We just celebrated back in 2023, August of 2023, we celebrated our 10-year anniversary, and we conducted a 10-year evaluation of the program. And so we have that evaluation ready. I will share the link in the chat a little bit later to really illustrate the impact of the work that we've done here as a result of the Father's Corps. And then our public health department, in our Alameda County Health, their Healthy Schools and Communities, they have included father-friendly implementation activities into 10 of their health pack contracts and 5 other of their other contracts, and that's been happening over the last 6 years. So we are starting to embed this in contracts, and I'm not talking just boilerplate language. I'm talking actual implementation activities so that these programs that have contracts with our county are being intentional around father engagement and support. And that is real systems change that I'm proud of that we're doing here in Alameda County. These are our father-friendly principles. Again, I mentioned they serve as a roadmap for organizations to intentionally see and serve fathers and father figures. I will put the link in the chat as well, so you can have the link to these father-friendly principles. I'll just copy and paste these. Some of our keys to success, why this has worked. Before I go there, I want to go back to our father-friendly principles. We also have developed tools. That's why I'm here, Togo. I'm sorry. We also have developed tools to support organizations with not only the implementation of the father-friendly principles, but the assessment of programs. So we have a father-friendly principles organizational assessment tool, which really, we don't hold that. We just put that out there. And what it really does is it gets folks and programs thinking about different things they can do to be more intentional with their engagement and support of fathers and father figures. And it also allows them to measure, are they father ready? Are we ready to serve dads? It's one thing to offer a program, but when dad walks in to take advantage or to participate in that program, is our front desk staff welcoming them? Do they see images of fathers in your collateral materials or hanging in your spaces? Are your programs being offered at times that make it so fathers can attend? Is there something as simple as a changing table in your men's room? When we started this program 10 years ago, we didn't have one. We had a dad show up to one of our activities with his newborn, and he's changing the baby on the couch in the lobby. And so just small things that you can do. Do you have images of dads on your website? Are you paying attention to what you name your programs? When I had my first child, I was 19. I don't know if I would have gone to a play group, and my stepmom was a early childhood expert. And I was still probably wouldn't have gone to something called a play group because I was too cool for that at 19. Or at least I thought I was. So paying attention to what you name your programs, creating positions that serve fathers, ensuring that you have men on staff that you engage in, not only when it's time to say hello to dad when he walks in, but are you engaging those men and having them contribute to the development and planning of the programming? And so these really serve as a roadmap. And then we have tools that support the use of the assessment of your program, but we also have an implementation tool which provides a step-by-step guide on a programmatic level, a systems level, and a practice level of implementing each of the 7 father-friendly principles. As far as keys to success, our first year, we established a male-only learning community. So we brought men together who work in the social, family, and community support field, focused on building their muscle around early childhood with a very intentional and unapologetic focus on engaging and serving fathers and father figures. That was important because over that first 5 years, when we convened this male-only group, what we did is it kind of developed into this army of father engagement specialists that were going back to their home agencies and having these conversations around the father-friendly principles and the importance of serving fathers and father figures. The introduction and adoption of the father-friendly principles was really key when the Board of Supervisors adopted these and included language that strongly encouraged all family and community support programs to not only adopt these principles, but take steps towards implementing these principles. That was really catapulted our work and helped us generate momentum. Developing our diversity of fatherhood photo bank. We have a photo bank of over 800 images of local fathers with their children. When we started this work back in 2013, and I was putting these slide decks together, I was, Google image searching and cropping out watermarks and purchasing very overpriced stock photos and reusing them in every piece of collateral material and slide deck that I had. So to remedy that, we developed the Diversity of Fatherhood Photo Bank, which you guys all will have access to if you're interested. You have access to over 800 images of fathers for free. We ask for very minimal information. We just want to know how folks are using them and where they're using them. And then also being responsive to the needs of fathers. So focusing on issues like co-parenting, navigating family court, making sure that we offered and father-centered and father-specific programming was also very important to the growth and success of our program. Beginning as a cross systems collaboration. So it wasn't just First Five or me telling folks what they should be doing, but it was a collaborative building of this Father's Core model. So it was not just us telling folks. Scaffolding multiple components of the program and continuing to produce resources and tools like Dad Discussions, which is our monthly fathers group. We host a fatherhood summit every couple of years where we're bringing dads together. We have the photo bank. We have the father-friendly principles. We have the assessment tool. We have the healthy relationships learning community. So continuing to grow and develop the program that are relevant to the needs of fathers. Our branding is important. Our logo, it shows up everywhere. And also highlighting that fathers, pointing out that it was a blind spot, highlighting that fathers were not being served by our family service programs. We have a lot of family service, a lot of parent service programs, not just here at First Five, but out in the community as well. And the majority of folks who were being served by those programs were moms and children, and then creating father-specific services. Parent groups are great. Family groups are great. What we were seeing is that dads weren't showing up to those. And so when we put a man in front of the room and leading the group, and we made it a father-specific program, we tended to get a much better turnout from our dads. What's next for us? Sharing and highlighting the findings of our 10-year evaluation. We've got our 2-day Fatherhood Summit, which is happening September 26th and 27th in Oakland. This is a free summit focused on Day 1 is focused on providers and advocacy. We're going to invite elected officials, decision makers, philanthropy, and service providers focused again on creating. This is going to be a West Coast portion of the summit. So we have partners from Oregon, Washington, and all of California who will be coming together on September 26th. And then on September 27th, it is focused on celebrating and honoring the critical role of fathers and father figures. Both days are free, so keep an eye out for information on that. If you're interested, if there are sponsors who want to be a part of that, you can find information on that as well. Expanding our healthy relationships learning community. Again, I can't stress enough how important healthy relationships and co-parenting is to this fatherhood work. And in supporting First Five California's fatherhood initiative, they're looking to launch a fatherhood initiative, and we're playing a key role in that. And I hope I stayed on track with time. With that, I will turn it back over to Tova.
Thank you so much. So I'm just going to repeat for everyone, the resources that Kevin just named are available to all of you anywhere in the country, outside of California included. I use those photos when I do presentations, and I'm grateful for the really beautiful representation of fathers and their children that you all make available, the father-friendly principles. I think Kevin will add those resources in the chat now, so I encourage everyone listening to check them out. We're going to move on in just a minute, but Josh and David, I'll just check quickly if either of you would like to add anything in terms of how you've seen programs approach assessing where they are in terms of father friendliness and how they might grow from there to better serve fathers.
Yeah, here in Ohio, we have the Ohio County Fatherhood Mobilization Initiative. It's a process where the county assembles a leadership team and goes through a needs assessment, community conversations, and develops an action plan. And it's extremely effective. But I did key in on Kevin. That's so much great information. Thank you. And David, and I just keyed in on the fact that you said organizations need to be ready to serve fathers, and that sustainability is so important. And being at the state level and not being at the level of boots on the ground, providing direct services, we do see that it's important to have that fatherhood champion in the county, that someone who is able to keep the conversation going at the local level. But most importantly, and what I think could get overlooked often, is making sure that you keep that fatherhood champion in position. So someone who's in that position may move on to something else. Do you have someone to step up and be that fatherhood champion? So that sustainability is such an important piece. So thank you.
Thank you. And Kevin, it sounds like you've built a lot of infrastructure at the county level and have so many partners in place to try and be attentive to ensuring that it doesn't rest on one person who could leave, that there's actually a commitment at the, at the community level to keep this going.
That's very true. We have some work to do on it. It helps to have the First Five Alameda County as the lead agency, and our other partners are falling in line and taking more of a leadership role. But that's a challenge, and it takes time. 10 years sounds like a long, it's not. These are systems that have been around for, decades. And so changing the way those systems function takes time and patience and stick-to-itiveness. So yeah, partners are important for sure. But a lead agency is important as well.
Yeah, thank you. And we have, across our presenters, we've got leadership of programs at the city level, the county level, the state level, kind of showing you how this happens at every level and how ideally it should be happening, at all of those levels at the same time to really strengthen support for dads. We are going to be thinking about assessment from 3 angles today. And so I want to make sure we have time to get to all of them. And so I'm going to turn to Josh now just to say that, we've covered in this webinar series often kind of how central fathers are to child well-being, but often fathers' own well-being gets overlooked. And so I'd love to hear from you if you could tell us about the work you're doing in Ohio, the tool you've developed, and how you think about assessing fathers' own well-being so that programs can better meet and respond to the needs of fathers.
Absolutely. Thank you for the opportunity. So to give a little context, I think, I know this is a conversation, but I do kind of want to put where this tool was developed and why. So I need to lay a little bit of groundwork. Here in Ohio, I already mentioned, we were established in law in 1999. We have a 20-person commission. We have a mission, purpose, and objectives. So our mission is to improve outcomes of Ohio's children and strengthen 2-parent families. And we do that by helping fathers become better parents, partners, and providers. Our objectives are to fund fatherhood programs. That is where the majority of our budget goes. Currently, we fund 9 core fatherhood programs that provide the case management services that we'll get into where the tool is actually being used. We also train professionals across Ohio. That is an evidence-based fatherhood curricula. We offer that training for free. We do things like what we're doing today, have conversations, engage the communities at the national, state, local levels, spreading the importance of fathers and fatherhood programming. We develop policy recommendations as well. That is important, being able to have a voice at the table when we're having conversations at the national or state level to make sure that fathers are represented. And I'm going kind of quickly so I can share these resources with you afterwards, because I do want to get to the well-being screening tool. So we do have, I mentioned, a 20-person commission made up of all three branches of government. We have the Supreme Court Justice appointing a commissioner. We also have the governor, his designee, and then we have bipartisan representation from our legislature. So 4 representatives from the state of Ohio and 2 senators. And then also we have represented on the commission folks from the public, and then finally various departments across the state. And I just want to highlight, just pause here and highlight the importance of having this diversity and viewpoints and where their positions are in government or in the public. For example, the Department of Mental Health and Addiction Services was key, and we'll talk about that with the well-being screening tool. We also have the Department of Health, Youth Services, Rehabilitation and Corrections, just to name a few. So when we say we fund fatherhood programs, we kind of group that into 4 different areas. If I start at the bottom in the light blue, we fund each June what we call mini grants for June's Responsible Fatherhood Month. These grants allow the communities to host father-child events, to spread awareness about fathers and the important role that he plays, and also to share education materials and guest speakers. And this is because each year our governor declares June as Responsible Fatherhood Month. And so that gives an opportunity to fund some of those smaller nonprofit local community organizations. If we go to the left in the yellow, that's the Ohio County Fatherhood Mobilization Initiative. It is a mouthful. That's the one I mentioned earlier. So it's an opportunity for us to partner with our county agencies and to help them spark that conversation of fatherhood programming within each county. And we can't do that without mentioning our partners, Ohio Practitioner Network for Fathers and Families. It's kind of like an association of all the fatherhood professionals across the state of Ohio. And so we contract with them, and they provide the county with a coach to help walk them through all of the steps that are needed for that mobilization. And again, I mentioned the assessment. So they go through and look at what is available as resources in their community, what are the gaps, and then they open up the conversation to the community. They host that meeting, and they ask the community to come in and give feedback. And then they take all the information that they've gathered through the research and through the conversations and develop that action plan that I mentioned. And that is both short-term and long-term, looking at what they can do with the funding that we provide them. And what the commission is able to provide them is a $10,000 implementation grant. It's a very small dollar amount, I know. It actually hasn't changed since 2011 when we started with this particular project. So we're hoping to increase that pretty soon, but it at least gets the county some funding to start with and try to find some programming to go along with their action plan. Right, and then our final area is our core fatherhood programming. If you look at the red, we call that the Serving, Educating, and Empowering Fathers Program, our See Fathers program. Such powerful words, making sure that we're serving our fathers, getting them educated, and giving them the knowledge and the empowerment to make a difference in their children's lives and their family and community. So looking at the graph here at the bottom, we fund 9 fatherhood programs across the state of Ohio. Each of those programs have to serve at least 2 counties. They serve all fathers, and then we reimburse them based on performance-based reimbursement for serving TANF eligible fathers, so temporary assistance for needy families. And these organizations serve fathers for all kinds of different barriers, but all of our programs have to provide 3 core programming. So parenting, the evidence-based fatherhood curricula training, and also co-parenting. And, Kevin mentioned how important that is, and it is an important element of fatherhood programming, ensuring that fathers are educated on how to have difficult conversations, on how to de-escalate situations when maybe that conversation is taking a wrong turn. And then economic stability, which is not only just finding a job, it's helping fathers become ready, job ready. So some of our fathers are justice involved and maybe have not had work in some time. And so our programs are there to help with that as well. So those are the 9 grantees. Now, if we kind of zoom in on just one particular grantee, if a father comes in to one of our programs, he is coming with all kinds of different combinations of barriers he may need help overcoming. Again, we have to offer those 3 core elements of our programming: the parenting, co-parenting, and economic stability. But when fathers come in, they may be needing help navigating child support, getting the modification for a child support order, driver's license reinstatement, paternity, going and getting parenting time. So there's so many barriers that our See Fathers programs are in position within their communities, have the strong partnership within their communities to help fathers through his barrier. So this is really the context of where the fatherhood well-being screening tool came about. We were at the probably the starting of the 2nd year of the pandemic, and we were seeing the research that all of us were, that some of the mental health declined within all of us, being at home or dealing with the pandemic. And it became important to us to make sure that, and it was always important, but to make sure that we had a tool that our fatherhood programs could use that would help them start conversations with fathers before he even starts talking about the barriers he needs help with. Let's ask Dad, how are you doing? How is life for you? I know as a father myself, as a man, I don't often get asked that first off. It's usually what the problem is, or I need your help with something. So we've gotten great responses from the ability to start the conversation that way. So let me bring up the tool. It has different areas within the tool, but it is a 1-page document. Let me know if you can't see that. So it's kind of divided into 3 different sections. So we're asking fathers about their healthcare, their physical health. So do you have health insurance, as an example? Do you have a primary care doctor? And then we ask about mental health, ask about how they're feeling. So there's nervous, hopeless, stressed, depressed, alone, and angry, and then some others. We also ask about substance use. So have you had substance use issues in the past, or do you find that your substance use now is impairing your ability to provide for your family, or something you want to look at getting help with? And then the last section is the social networks that are available to the father and what he actually uses to help de-stress. So do you have hobbies? Do you go play basketball? Do you go to some faith-based event, church, or worship? And what we found is this is extremely helpful with, again, that conversation. It gets updated regularly. So it's a living document. The programs are able to adjust as the father either needs another area to focus in on, or discloses more information than maybe he felt comfortable with at that first meeting or the first couple of meetings. So this is continually updated as the father evolves along with fatherhood programming. So some of the data that we have, we don't publish it, but at least yet, it's relatively new. I think this is our 3rd full year. But the data that we're seeing from the fathers is very informative, and it's actually driven us to ask for more funds to provide the fatherhood programs. So our fatherhood programs are not mental health professionals. They're not medical professionals. The tool is used more as a guide for the fatherhood professionals to refer that father over to community partners that may be able to help him through that particular issue that he has that comes up through this tool. So we see, for example, just looking at the feelings section, so the emotional well-being, the mental well-being. If we look at the responses on the Likert scale for nervous, all of the time and most of the time came up at about 21%. So that's a significant portion and could be a major disruptor for fathers. And that same kind of trend holds true for many of these negative attributes that kind of fathers feel at different points in their life. So stress, alone, restless, or fidgety. So that's kind of helped us ask for more funds so that fatherhood programs can be more intentional with helping fathers navigate through either going to medical appointments if he asks, or to advocate for him in a medical appointment with a doctor or professional. So, any questions?
Thank you. So Josh, I'm gonna pivot us a little bit so we get through all of our content, but I'm gonna ask if you're able to respond in the chat. There are a couple of questions that are related there, asking about if there are assumptions about substance use. They don't see a non-applicable option, and I'm gonna ask you to respond to that one in the chat, and just very briefly ask David if you'd like to, or Kevin, add anything in terms of how you would holistically assess a father's strengths and challenges and circumstances. Anything that you would like to add to that before we move into David talking about engagement in assessing child well-being? David?
Yes, I would just like to add that the Direct Assistance for DASH project, we do a number of assessments. Actually, family well-being is a core component within our program to assess. So one of the things, assessment tools that we use is very similar to this assessment tool that Joshua mentioned, is our caregiver demographic background, which identifies that looks at certain stressors. What we noticed, and so let me back up. So we administer this upon enrollment, and then every 6 months. Moving forward. What we noticed within our program is that the initial assessment, father may have maybe 2 or 3 stressors. After 6 months, it increases, and it increases because obviously the feedback we got from the fathers, they're like, I don't know, I didn't know you, I didn't have a strong rapport with you, and so we notice again within that 6 months, fathers are able to engage much better, feel more comfortable being truthful and honest about what's going on in their worlds, which allows us to then operate in a way to provide them some resources and services in an authentic way.
Thank you. And such an important comment too about when you do an initial assessment before you've established trust, that you may actually see stressors go up, and it's not about things getting worse. It's about feeling comfortable to open up. Kevin, anything you want to briefly add on this before we turn to our third topic?
I don't think so. I think it was all covered.
Thank you. So I'm going to turn to David now. And so David, if you could talk to us, the DAD Project works with men as they become fathers and across that transition to fatherhood in the early years. And one of the things that you do so very well is really engage fathers in assessment of their children's health and development. So if you could tell us a little bit about what that looks like over the course of working with a father.
Absolutely. And as I mentioned, leading with that initial assessment, building rapport with the fathers is very important. One of the strategies that our fatherhood involvement specialists participate in is really it sounds simple and basic, but it's very is one of the hardcore foundational things within our program is leading with trust, like and truth, dignified strategies, as well as respecting fathers with the opportunity of allowing dads to be human. And that element is so important when building rapport with fathers in order to get them to participate inside the program and allowing them the flexibility of making mistakes and allowing them the opportunity to disengage and re-engage. It makes me think of a situation with one of our fathers who, upon enrollment, we did the initial assessment, and I'm telling you, this guy had high markers of within, high stress markers, high markers in perceived stress and abuse, as well as his childhood experience survey was really high as well. And so our objective was to decide and figure like how can we service this father the best way we can while helping him out on his parenting journey. And what we know, about hierarchy of needs, it's hard to focus on our certain specific things if certain needs aren't being met. This particular father wanted to gain employment, but because he has been off his medication and just not really engaged with his treatment plan, his therapist wanted him to go upon get a mental health assessment. And so the client disengaged. So we didn't hear from him in several weeks, and he finally contacted his fatherhood involvement specialist after about 14 days while he's institutionalized. And so again, think about the connection that was made initially and the desire that the father wanted to be inside the program. So he contacted his fatherhood involvement specialist to inform him like, hey, I'm really committed to be inside this program, but I have to take care of this. Allowing that father that space and that time. After 21 days, the father came out of treatment. I'm a new person with a different focus, different edge, with the objective to take care of himself, his own personal well-being, as well as to then be the father that he wanted to be. So with that said, like those assessments that actually I'm gonna share something with you all just to show you and put in context of the number of assessments that we perform throughout our program. Let me show you quickly. So if you look at this is what's called the DAD packet guideline. So from enrollment, you can see there's a number of things that we have to capture, but within the first 90 days is where the connection needs to happen. And it needs to be intentional. And again, like I mentioned, that we lead with dignity, lead with truth. So we tell the fathers, like, hey, these are the assessments that we have to administer. And the question always why. And what it does, it allows our fathers to reflect about who they are now, who they were as a child, and then where they want to go as a parent. And these overall assessments allows us then to focus upon the health assessments and developmental screenings for their own children upon when the child is present. So those so then what occurs, the fatherhood involvement specialists partner with the fathers by providing resources. Now, part of our curriculum, we utilize parents as teachers. One of the you have to provide some type of tangible information, a handout, and a resource that goes along with that particular handout, which allows the fathers to engage with their child. So what I told you, I mentioned earlier that one of the components is family well-being. So we focus on the father's well-being. Another component is parent-child interaction. So again, utilizing the assessments to decide or to figure out where the father's at, where he has been, and then allowing the father, then fostering the environment of the father to engage with the child. Within that said, we assess the father's engagement level with their child, which is going on to developmentally appropriateness. The fathers are one of the misconceptions within fatherhood services and programs is that fathers don't want to be engaged. They are hesitant. But I tell you what, within the direct assistance for DASH project, we have a great opportunity to see our fathers be actively engaged with their children, asking questions, and then utilizing developmental milestones like CDC milestones as well as ASQs to assess their children overall. So they are definitely equipped. Again, going back to the initial focus, what we say about our program is that we recognize and prioritize dads as the primary caregiver of their child. I know I went through that really quick in the interest of time, so I wanted to ensure that we have some opportunity for questions, comments, compliments, or concerns regarding the things that we discussed.
Yeah, thank you so much. And thanks for giving us the speedy version to allow some time for discussion. I'm thinking about what Kevin said earlier in terms of how many dads you hear from who kind of went into school and nobody greeted them, or they felt not seen there, go to the pediatrician you mentioned and don't. And so David, you're saying you really center fathers and assume that they want to be involved and provide the support to learn about and answer those questions that are pretty standard. Some of the measures you use, like the ASQ, looking at child development, working with fathers and empowering them as experts on their children to answer those questions is really striking. And I just want to kind of flag that for our audience, because it often comes up in questions in these webinars. Well, if we're having difficulty engaging fathers, or how do we kind of engage fathers, and your program starts from a place of assuming fathers are active primary caregivers, have that capacity, want to be those dads, and have that level of involvement. And you find in your work, and I love hearing about it, that just how responsive fathers are. I'd love to just ask briefly, Kevin, Josh, anything you want to add about how you engage fathers, or how you see fathers' involvement in assessing the well-being of their kids, and what it adds to have the perspective of fathers on children's development as well as mom's perspective.
I really appreciate David's comment about leading with dignity and truth. If we think about how often we tell and show our dads, or tell our dads what they should be doing, what they could be doing, or what they're not doing. If you're looking to engage dads, you have to leave that so very far behind. It's just because we hear that all day. We see it in commercials, we see it in TV shows, we hear it directly from family, from our co-parents. So if we're looking to engage dads in an authentic way, we have to see them. And this was one of the things that separates our program from some of the other father services. We see fathers as sympathetic figures who deserve to be engaged and supported, and come from that angle. Not that I have to prove that I'm engaged as a dad. I have to prove that I am worthy to be a parent. Whereas we come and approach them as, you are worthy, and we treat you in that way. We don't have to say it. We treat you in that way. And that helps us develop that trust and authenticity between provider and client. And that's not really anything different than we do for moms, right?
Right. And thank you. That's just general best practice. It's
Right.
We can talk about it with fathers, but it's with anyone you're trying to serve,
Exactly.
any member of the family. Yeah. Thank you.
Exactly.
One of the things I want to add, thank you, Kevin, for bringing that up, is that something that one of our fatherhood involvement specialists said at a conference recently is that it's important that you do not fear the population that you're attempting to serve. And I think many times when we work in fatherhood services, we have this fear. However, I want to acknowledge that our program is literally mirrored from a maternal child health program. All we did was, I'm gonna show a quick picture if I can, because I will show you, because it's an element of connecting with everyone, and something that Kevin mentioned as well. Our program reflects the population at which we target. So we have men, we have Black men, they're educated, and have lived experiences. And so this is one of the, again, an element of connection. So we have dignified processes with our fatherhood involvement specialists, but also we have programmatic dignified processes and with intentional connections. And so we take our job really serious, and not that everybody else doesn't, but we've had a journey of assessing our programs to ensure that we, again, assess the fathers that we want to work with.
Thank you. I'll maybe just build on that by asking, there are a couple of questions in the Q&A box that speak to the challenges, the specific challenges for women doing work with fathers that might be different from when you have a shared identity as a father with the fathers you're serving and can relate on that level. And there are a couple of questions here about, if you have any tips or guidance. You are all fathers yourselves and professionals who work with fathers, for how people doing the work who are not themselves fathers, and maybe not themselves men, can become more competent or engage respectfully or reflexively to think about how they work with fathers. Kevin, I'm guessing that may come up actually when you do work with programs, thinking about implementation, and if their staff is primarily women, that probably comes up. Would you be comfortable starting with that one, and maybe others can chime in as well?
Sure. It does come up. Again, I think women can engage men, and they can support fathers in an effective way. It's about that I go back to David's comments about lead with truth and dignity, um, and leave that other stuff behind. And also patience. Fathers aren't used to being served in a lot of these settings. So because we invite them, or because we put a flyer out, or because we launch a program, or we receive a grant and then launch a program, they may not show up right away. I encourage our providers that we work with to incentivize to get dads through the door. And some folks have a feeling about that, but I think if dads aren't used to being served, then you do what you got to do to get them through the door, and then you blow them away with your programming to have them come back. And so that is the feedback that we give. Also, identifying dads who may be in your circle that you do have relationships with to possibly co-facilitate with you. So it's not just you in the front of the room looking to engage these dads, but you also have a fatherhood leader that you can bring to the front of the room, and that also allows them to build their muscle and leadership around this work. So those are just a couple examples of how you can engage dads as a woman in this field.
Thanks.
I hope that's
David,
helpful.
maybe I'll just ask, I appreciate those thoughts, Kevin. And David, I'm wondering, I know you partner sometimes with the Mom Doula program. I also wonder if you could just talk a little bit about partnering to serve the whole family and how you think about different roles and ways of cooperating to really support the parenting of moms and dads.
Yes, thank you so much, because I was going to mention that. So within the City of Market Health Department, we have a number of maternal child health programs, one being the Birth Outcomes Made Better doula program, where we have the opportunity to, where mom is being served, dad can also be served within the Dad Project. And so one of the things that Mom Doula, and as well as our Miriam program, Empowering Families in Milwaukee, has done is they're doing the work. One of the questions that I saw is that what is it? How can female-led organization or dominated field can be more competent in working with fathers? I'm gonna say you do the work. One of the things that we do within our presentations is that we ask people about their experience with fatherhood. And like Kevin mentioned earlier, is that your experience with fatherhood will dictate how you view programming, how you view budget, and how you view inclusivity. One of the things that what we do effectively within the City of Milwaukee Health Department is that we go down those journeys and have some of those tough conversations, which allows us to service the entire family. So again, our programs are, we work collectively together, but also this is new. When we identify, how we talk about our space, we say this, fatherhood is more than a guest in the house of maternal child health, right? First, we got to acknowledge, like, yeah, we are viewed as guests, but then we have to position ourselves to be more than a guest by working collaboratively together to service the family.
Thank you so much. So I see there are a lot of questions, and an hour goes by quickly when we have so much to discuss. So I'm going to invite Josh, Kevin, and David, if you are comfortable with people reaching out to you with follow-up questions, you're welcome to put emails in the chat if you would like. And I'm also going to ask each of you if you have any closing thoughts, since we have just a couple of minutes and there may be things you wanted to add, but we didn't quite have time to get to everything. Josh, if you were up for starting us off, maybe I'll start with you, since I didn't get to kind of pull you into the discussion. Any closing thoughts that you would like to share?
Yeah, just to piggyback on that conversation we just had, in about 30 seconds, is it really does come down to organizations having the right staff in place who understand the father's background, because we're all dealing with different cultures and subcultures within populations, and that's helpful. And just understanding that we need to set our biases aside. We all have them; they're good, helpful in situations. But whatever you have with your background with fatherhood or your father, just remember that that's not the same experience that you may be working with in that particular situation.
Thank you so much. David, would you like to go next?
Yes, just piggybacking on the whole idea that the myth that dads don't want to be engaged in program services, they do. Dads are dope, and they can help improve maternal child health outcomes, and the data's there. And I encourage you to approach fathers with dignity, build intentional connections to develop trust. And then the biggest other thing is to take risk. It's okay to take risk. It's okay to get it wrong. It's okay to fail forward. within your program and services.
Kevin, would you like to go next?
Start the conversation. You know, if you don't have any father-centered services or father-focused programming, it's a good thing to just start off with a conversation on what would it look like if we engage dads? What could it look like if we engage dads? And identify the low and no cost things that you can do today. Because there are things you can do today that are small that will really move the needle a bit for those organizations and programs that are just starting out.
Thank you. I'm going to share one last thought and then turn it over to you, Natea, to close us out. And that last thought is that it was a formative experience for me as a doctoral student when I did research where I was interviewing expectant mothers and fathers individually. And whenever I interviewed a mom first, often it would happen that they would say, you know, he may not have a lot to share. That's, you know, maybe a brief interview, but, you know, kind of preemptively not being sure the dad would really engage. And my conversations with fathers went so long, and I was interviewing fathers after prenatal appointments, and they said, this is the best part of the visit. Someone's asking me what I think and talking to me about my experience as I become a new dad. So I just want to echo Josh, David, and Kevin and saying, you know, you get started. And I think for those who are thinking about expanding in this direction, I think you'll be blown away actually by how eager to be involved fathers are and receptive. And even when it's a woman who's doing the engagement, how being asked is so well and warmly received. So anyway, thank you. Huge thank you to our tremendous presenters. You are all doing such terrific work, and thank you for sharing it with us. And Natea, I'll turn it to you.
Yeah, I'm just going to close us out and echo what Tova just said. So thanks so much to Dr. Tova Walsh, Kevin Brumman, David Comer, and Joshua Counselor for sharing their time, experience, and insight with us today. As we mentioned before, we'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email. So thank you all for joining us, and have a great rest of your day.